We're talking to Sarah Fay this morning. She is an accomplished essayist whose work has appeared in the New York Times, the Paris Review, and the Atlantic. She's currently on the faculty at DePaul and Northwestern universities.
Her latest work is a memoir and a critique of how we diagnose mental illness. Over the course of 25 years, Sarah says she has been diagnosed with 6 different conditions, from anorexia to bipolar disorder. The book is Pathological, the true story of 6 misdiagnoses. Thank you for joining us this morning.
Sarah.
Thank you so much for having me. I'm thrilled.
We have learned so much more about this over the last 40, 50 years, and it's my understanding that it's more fluid and subjective and not, boom, you have this, boom. So does it surprise you that you've been misdiagnosed?
Well, it was very surprising in that I didn't know that. So you're far more aware than I was when I went through the process and when I started in the mental health system. I really believed that they were all scientifically proven, that they were as reliable as a cancer diagnosis or a diabetes diagnosis. I never thought, wait, why don't they have a test? Why don't they have, why can't they show me a blood test that proves, yes, I have this? And what's interesting is I chose the word misdiagnosis in the title because a misdiagnosis is actually something that's inaccurate, incomplete, or incorrect. So sometimes I was always searching, and many people who've been through this will understand, and suffering from psychic and emotional pain. And sometimes it was incomplete, sometimes it was incorrect, and sometimes it was inaccurate. But I couldn't find healing, and I couldn't find relief in the diagnosis alone.
I think that's what's so frustrating. I had a loved one go through this process, and with the misdiagnosis, you end up sometimes on medication that is incredibly powerful, that completely removes your personality from it. So what would you recommend if you question a diagnosis given to you from a psychiatrist? What would you recommend? Going to get a second opinion, or what processes would you take?
That was something I also didn't know. Get a second opinion, and I wasn't aware of that. The other thing to be aware of that a lot of people are going through now is much of the diagnoses are coming from primary care physicians. 5 of my 6 diagnoses came from primary care physicians. So we tend not to question those doctors. It's very hard, and I understand that. I think that questioning it is also just about questioning yourself and entertaining, does this diagnosis feel right? Or should I breach this with someone else, or discuss this with a therapist, or something along those lines?
Well, I'm surprised you would give so much weight to a primary care physician, because the brain being far more complex than the rest of the body, the experts have enough trouble dealing with it. Do they not? There's disagreement among the experts. Exactly.
And so general practitioners, primary care physicians, really aren't trained to use the DSM, the Diagnostic and Statistical Manual, in the same way that psychiatrists are.
Yeah, and so I think some people feel like, well, I'm going to go to a psychiatrist, and they're going to do a test, and I'm going to get this pill and this therapy. But it is a lot of trial and error and a lot of work, I would imagine. So what advice would you give for parents who are trying to decipher whether their kid is just difficult or there's something wrong?
Well, what I didn't know, and again, I'm not a doctor, I'm not a mental health professional. I can only give what my experience was and what I went through. And what I went through over those 30 years is I didn't realize there are 2 steps to healing from mental health, or from a mental illness, or a mental health diagnosis. And the first one is to get treatment. Get treatment. And we have to do that and commit to the treatment. But the second step is to realize, to get that treatment, you're given a label, a diagnosis. And it's so that doctors can communicate with each other, but not, what I did was I over-identified with my diagnosis.
It becomes your identity.
It became my whole identity, my whole life. And I attributed all of my thoughts and feelings and emotions to my diagnosis. And it really limited my life. When I was told I had bipolar disorder, I believed that I would die 10 years earlier. I believed I could never hold a full-time job. I would never have a relationship. And a lot of that is from the misinformation that's on the internet. So that's the other thing I would tell parents is, if I could speak to my younger self, I would say, beware of the internet.
Vet all of this information,
yes, exactly.
I was thinking about the pandemic, and there's been so many studies done now about some of the dangers to mental health that it created, just in terms of isolation, not being stuck in your home. How do you feel about what is being done now to kind of rectify some of the damage that maybe potentially was done over the pandemic?
I think one thing I've noticed, and with Pathological and publicizing it and hearing from psychiatrists, from primary care physicians, from therapists, we're really all in this together. We really are. And I think everyone means very well, and we're all trying to get treatment to those who need it. The one thing I want to express with my book is, one, to give people the information they need, being on the patient side or to be a family member of a patient, meaning kind of correcting all that misinformation that's on the internet about the diagnoses that we receive. So that's part of it, and just knowing the diagnoses are limited in what they can do for us in terms of healing.
All right, the book is called Pathological, and you